What if your legs were attempting to preserve your life, yet you remained unresponsive? Our bodies communicate subtle signals long before they escalate into urgent cries for attention. Your legs serve a purpose beyond mere locomotion. They act as messengers, discreetly alerting you to potential underlying issues. Frequently, these indications are dismissed with rationalizations such as aging or fatigue from prolonged standing. However, consider the possibility that the cramping, swelling, or unusual tingling may signify something more significant, something your body urges you to acknowledge before it becomes critical. Let us be candid. One may awaken in a hospital bed, reflecting on the warnings that were evident all along, warnings that were disregarded. The reality is that one's legs can disclose what blood tests may overlook: cardiac issues, nerve damage, and even early indications of a stroke. Therefore, before attributing that discomfort or weakness to aging, pause and consider this. What is my body attempting to communicate? In the following moments, we will explore 4 subtle yet significant signs that your legs may be conveying. Do not dismiss them. Your future self may express gratitude. Many older Americans endure subtle symptoms they perceive as mere aspects of aging. However, numerous minor irritations such as tightness, tingling, and swelling serve as critical indicators of underlying health issues. Particularly concerning are the warnings associated with the legs, which are frequently disregarded until it is too late. In today's video, we will elucidate 4 significant signs that your legs may be signaling deeper health problems. These are not trivial discomforts or indications of aging. Rather, they are red flags pertaining to your cardiovascular health, nerve function, or circulation. You may be experiencing stress. You will hear authentic narratives, comprehend the science in accessible terms, and, most crucially, discover how to respond if you identify these signs in yourself or a loved one. Our objective is straightforward: to assist you in remaining resilient, self-sufficient, and cognizant of your body's signals before minor issues escalate into significant ones. If this resonates with you, please subscribe and activate notifications to ensure you do not miss our weekly life-saving insights. Now, let us explore the first sign and the unexpected rationale behind it. Leg cramps during the night may pose greater risks than one might assume. A sudden onset of sharp leg cramps can abruptly awaken you. Initially, this painful spasm in the calf, tightening in the foot, or seizing sensation in the thigh may appear innocuous, lasting for a minute or two before gradually subsiding. You may attempt to alleviate the discomfort by rubbing your leg, flexing your toes, or hydrating, subsequently returning to sleep under the impression that it was merely an unfortunate occurrence or an indication of aging. However, what if these cramps signify more than just a transient issue? What if persistent annoyance is an early indicator of a more profound issue within your body? This was the case for Margaret, a 69-year-old retired piano instructor from a tranquil town in Ohio. She had consistently maintained an active lifestyle, walking in her neighborhood each morning, cultivating her vegetable garden, and performing at her local church on Sundays. However, over several months, a shift occurred. She started waking up multiple times a week, typically around 2 or 3 a.m. In the morning, Margaret experienced sudden, excruciating pains radiating through her calves. Initially, she attributed this discomfort to overexertion from weeding or excessive walking the previous day, even blaming her sandals. However, as the cramps intensified, became more frequent, and extended to her thighs, she resolved to consult her doctor. The examination encompassed a physical assessment and vascular testing. The results were alarming. Margaret was diagnosed with the early stages of peripheral artery disease, PAD. The arteries had begun to constrict, restricting blood flow to her legs, particularly when she reclined at night. Her body was unequivocally signaling for assistance, with the leg cramps serving as warning indicators. From a medical standpoint, these nocturnal cramps may signify various conditions, many of which are prevalent among older adults. Impaired circulation frequently emerges as a primary factor. As we age, our arteries inherently stiffen and may develop plaque, especially in individuals with a history of hypertension or hyperlipidemia. Smoking and reduced circulation to the lower limbs, especially when the legs are elevated during sleep, deprive muscles of essential oxygen and nutrients necessary for proper relaxation, potentially resulting in cramping. Another prevalent cause is an electrolyte imbalance. Minerals such as potassium, calcium, and magnesium are crucial for muscle function, and even minor deficiencies can induce spasms. Diuretic medications, frequently prescribed for hypertension or heart failure, can gradually deplete these minerals. Furthermore, nerve-related conditions may also contribute. Conditions like diabetic neuropathy can irritate the nerves regulating leg muscles, particularly during periods of rest, thereby increasing the likelihood of cramps. Frequently, a combination of these factors contributes to the occurrence of cramps, which should not be trivialized as merely a consequence of aging. Fortunately, there are pragmatic and effective strategies to mitigate or even eradicate these painful episodes. Primarily, maintaining adequate hydration throughout the day is essential, as older adults often consume insufficient water, either to minimize bathroom visits or due to their. As one ages, the sensation of thirst diminishes. However, dehydration significantly increases the likelihood of cramps. Gentle stretching prior to bedtime can be highly beneficial. Simple routines such as toe pointing and flexing, calf stretches against a wall, or light yoga can effectively prepare muscles for restorative sleep. If permitted by your physician, magnesium supplements may be considered, as some studies indicate they can alleviate nighttime cramps, particularly in older adults. Nevertheless, it is imperative to consult your doctor before initiating any supplementation. Individuals on medication may find that wearing compression socks during the day enhances circulation and mitigates fluid accumulation, potentially preventing nocturnal cramps. Crucially, if you experience cramps multiple times a week, particularly accompanied by symptoms such as numbness, skin discoloration, or fatigue, refrain from self-diagnosis. Seek medical evaluation. A straightforward assessment, such as the ankle brachial index, can identify circulation problems early, and prompt intervention can avert more severe complications in the future. Margaret heeded her physician's counsel. She initiated a walking regimen, modified her dietary intake, incorporated a mild nocturnal stretching routine, and commenced a low-dose medication to enhance circulation. Within several weeks, the nocturnal cramps diminished. More significantly, she experienced an increased sense of agency and awareness regarding her body's signals. Her narrative serves as a reminder that pain, though uncomfortable, frequently acts as a messenger rather than a form of retribution. By attuning ourselves to these signals promptly, we may alter the trajectory of subsequent events. Furthermore, regarding timeliness, warning signs are not universally painful. The subsequent indication is insidiously subtle, commencing with a slight tingling or unusual numbness in the feet. This sensation is so mild that it may be disregarded for weeks, yet it could signify one of the earliest manifestations of a more severe condition. The second sign involves tingling, burning, or numbness in the feet, particularly when at rest or attempting to sleep. Initially, it may resemble a gentle vibration or the pins and needles sensation experienced when a foot falls asleep. While asleep, you may wiggle your toes, alter your position, and remain oblivious to it. However, when this peculiar sensation recurs nightly, or when your feet begin to feel enveloped in cotton or lose sensation entirely, it is imperative to take heed. Your nerves may be signaling a warning prior to the onset of more severe damage. This was the experience of Joe, a 71-year-old retired mechanic from Tulsa, Oklahoma. For years, Joe endured what he referred to as tired feet after decades of standing on concrete. While lifting heavy tools and exerting himself beyond his physical limits, he attributed the numbness and tingling to the inevitable wear and tear of his body. "I figured I earned these old feet," he would jest with his friends. However, he began to observe a concerning trend. He was tripping more frequently. Navigating uneven terrain became increasingly challenging, and he lost the sensation of the ground beneath him. One morning, he nearly tumbled down the stairs due to his inability to perceive the edge. His wife urged him to consult a physician, and following a comprehensive assessment, following blood work, Joe was diagnosed with type 2 diabetes, a condition of which he was previously unaware. The numbness in his feet, as explained by his doctor, was a consequence of diabetic neuropathy, a form of nerve damage induced by sustained high blood sugar levels. If detected earlier, the progression could have been mitigated or even averted. However, due to Joe's failure to recognize the warning signs, His nerves had already sustained considerable damage. From a medical perspective, tingling or numbness in the feet can be associated with various causes, yet diabetic neuropathy remains one of the most prevalent. Commonly observed in seniors, prolonged elevated blood sugar levels can damage the minute blood vessels that deliver oxygen and nutrients to the nerves, particularly those distal from the heart, such as in the feet. This impairment disrupts nerve communication with the brain, resulting in symptoms such as burning, tingling, heightened sensitivity to touch, or complete loss of sensation. However, diabetes is not the sole potential cause. Poor circulation, vitamin B12 deficiency, hypothyroidism, and certain medications, including chemotherapy agents, may also contribute. Statins may also induce nerve damage, and in rare instances, these symptoms could indicate more severe neurological disorders such as multiple sclerosis or spinal complications. It is crucial not to speculate, procrastinate, or presume it is merely a consequence of aging. If you are experiencing these sensations, several measures can be undertaken, but the foremost and most critical step is to consult your physician for a comprehensive evaluation. A straightforward blood test can assess for diabetes or vitamin deficiencies. If diabetes is managing blood sugar levels is paramount. Regular exercise, dietary modifications, and prescribed medications can aid in controlling the condition and preventing additional nerve damage. If poor circulation is a factor, analogous lifestyle adjustments and possible medications to enhance blood flow are recommended. In certain instances, your physician may refer you to a neurologist for further evaluation, particularly if symptoms are advancing. Additionally, at home, it is beneficial to inspect your feet daily, regardless of circumstances. Individuals with neuropathy frequently remain unaware of cuts or blisters that may lead to infections. Properly fitted footwear and soft socks can safeguard the feet, while abstaining from alcohol and smoking may enhance nerve health. Some individuals experience relief through gentle foot massages, warm water soaks, or the use of foot rollers to stimulate blood circulation and nerve endings. Although over-the-counter creams may offer transient alleviation from burning or tingling sensations, they do not address the underlying issue. Consequently, a medical diagnosis is imperative. Joe now monitors his blood sugar, consistently dons supportive footwear each morning, and never neglects a medical examination. Although his nerve damage is irreversible, it has stabilized. More significantly, he has acquired the ability to heed his body's subtle signals. Occasionally, the indications from our legs pertain not to nerve issues, but to pressure accumulating in unseen areas that our legs can detect. When swelling in the legs or ankles becomes a frequent occurrence, it may not merely be attributed to salt or heat. It could signify the heart attempting to communicate. This is precisely what we will address. Discuss the third sign, persistent swelling in the legs, ankles, or feet. You may observe that your socks leave deep indentations around your ankles by day's end, or that your shoes feel constrictive despite no change in weight. For some individuals, the swelling is mild, presenting as slight puffiness after prolonged standing. However, for others, it can become more chronic, characterized by heavy legs, puffy ankles each evening, and occasionally skin that appears taut or glossy. While it is simple to attributing it to a high-sodium diet, prolonged periods of standing, or summer heat, persistent edema may indicate a more severe underlying condition, particularly concerning the heart or venous system. This was the case for Edith, a 75-year-old grandmother of 4 from Charleston, South Carolina. For several months, she observed that her ankles would swell each afternoon. She presumed it was merely a consequence of aging, perhaps exacerbated by excessive sitting while knitting or watching television. She would elevate her legs and hydrate, resulting in a significant reduction of the swelling. In the morning, changes began to manifest. The swelling ascended from her ankles to her calves, rendering her shoes ill-fitting, while her legs grew increasingly stiff and painful by evening. One day, she attempted to wear her Sunday church shoes, but was unable to do so. This prompted her daughter to urge a medical consultation. Following a series of tests, including a chest X-ray and an echocardiogram, Edith was diagnosed with early-stage congestive heart failure. Her heart was not pumping blood as effectively as necessary, resulting in fluid accumulation in her legs. The swelling was not merely an inconvenience. It was a warning signal that her heart had been transmitting for months. Swelling, particularly in the lower extremities, is medically referred to as edema. In older adults, it frequently arises from fluid retention due to inadequate circulation or cardiac deterioration. When the heart fails to pump blood efficiently, fluid can seep from the blood vessels and accumulate in the adjacent tissue, typically manifesting first in the feet and ankles due to gravitational effects. Another prevalent cause is chronic venous insufficiency, a condition characterized by compromised venous function in the legs. Difficulty in returning blood to the heart results in fluid accumulation, which can be exacerbated by prolonged standing or sitting. Additionally, renal or hepatic dysfunction may contribute to edema, as these organs play a crucial role in fluid regulation. Certain pharmacological agents, such as calcium channel blockers or corticosteroids, may also induce or exacerbate lower extremity swelling. Regardless of the etiology, persistent edema should not be overlooked, particularly if accompanied by dyspnea, fatigue, or rapid weight gain, as these symptoms may indicate deteriorating cardiac function. Upon observing this type of swelling, it is imperative to undertake significant measures, commencing with an accurate diagnosis. Avoid conjecture or online recommendations. Your physician may conduct blood tests, cardiac imaging, or leg ultrasounds to ascertain the underlying cause. If cardiac involvement is identified, medications such as diuretics may facilitate the elimination of excess fluid and alleviate strain. In cases of venous insufficiency, compression stockings can enhance venous function and diminish pooling. Additionally, elevating your legs above heart level multiple times daily can aid in fluid management. Enhancing drainage efficiency involves reducing sodium consumption, engaging in moderate physical activity such as leisurely walks, and tracking daily weight fluctuations. Regular medical checkups are essential, particularly for individuals with hypertension or a history of cardiovascular issues, to preempt complications. Edith now consistently wears compression stockings, monitors her weight each morning, and adheres to her prescribed cardiac medications. Although the swelling has not completely resolved, it remains manageable. More importantly, she comprehends her condition. Her body was attempting to communicate with her. She no longer dismisses minor indicators as mere effects of aging. Her narrative serves as a poignant reminder that when our legs become edematous, it is not solely a matter of comfort. It may signify our heart seeking assistance. While certain manifestations, such as swelling, are conspicuous and difficult to overlook, others may insidiously emerge. Occasionally, they present themselves during seemingly simple actions, such as rising from a favored chair. You brace your hands on the armrest, exert effort, and ponder why this task has suddenly become so arduous. That struggle could indicate a deeper issue. Muscles are conveying an alternative message, which we will explore next. The fourth indicator of weakness is difficulty in rising from a chair. If you find yourself struggling to stand from a chair without utilizing your hands, whether it be your cherished recliner or the dining chair where you enjoy reading the morning paper, you may notice that you are leaning forward more, pressing your palms on the armrests, or pushing off the table to assist in lifting yourself. You may dismiss it as inconsequential, attributing it to the chair or perhaps your own condition. Today my knees are rigid. However, if this occurs frequently, and if your legs exhibit weakness or delayed responsiveness, it may indicate a more grave concern, the gradual atrophy of your muscles, and a decline in the strength necessary for maintaining independence. Tom, a 73-year-old retired high school coach from Boise, Idaho, had always taken pride in his fitness. In his youth, he guided his basketball team to championships and kept pace with players half his age. Yet, over the past year, he has observed a change. Described the difficulty he experienced in rising after watching a film or dining. Initially, he dismissed it with humor, remarking, "I must be getting lazy." However, when he found himself relying on his hands to assist in standing, and when basic activities, such as ascending stairs, rendered his thighs trembling, he recognized that something was amiss. A consultation with his physician validated his concerns. Tom was exhibiting signs of sarcopenia, an age-related condition characterized by the progressive decline of muscle mass and strength. Furthermore, during a subsequent assessment, his doctor observed tremors in his hand and slight deceleration in his gait. Subsequent evaluations revealed that Tom was diagnosed with early-stage Parkinson's disease, a condition that, among other manifestations, leads to muscular weakness, impaired balance, and movement challenges. His difficulty in standing was not merely a consequence of physical unfitness. His legs had been signaling two significant underlying problems. Medically, challenges in rising from a seated position can indicate various concerns, with one of the most prevalent being sarcopenia affects nearly 1 in 3 adults over the age of 60. As we age, we naturally lose muscle mass unless we actively maintain it through strength-building activities. This decline impacts not only appearance, but also functionality. Muscles are essential for balance, mobility, and blood circulation. A loss of strength increases vulnerability to falls, fractures, and dependency on others. Additionally, vitamin D deficiency is prevalent among seniors, particularly those with limited sun exposure. Insufficient exposure to sunlight or diets deficient in fortified foods can result in inadequate vitamin D levels, which are crucial for optimal muscle and nerve function. Low vitamin D levels may lead to fatigue, weakness, and diminished reflexes. In more severe instances, neurological disorders such as Parkinson's disease or early indications of a stroke can hinder the body's capacity to rise, maintain balance, or coordinate movements. Consequently, physicians frequently employ a straightforward chair rise test as a rapid assessment tool. Difficulty in standing from a chair without hand assistance often serves as a warning sign necessitating further evaluation. Regaining control and rebuilding strength in later years is essential. One of the most effective methods is resistance training, which involves gentle, consistent exercises targeting major muscle groups. This does not necessitate heavy lifting at the gym. It can be as straightforward as performing 10 repetitions of standing up and sitting down from a sturdy chair, executing leg lifts while holding onto a counter, or utilizing resistance bands to fortify the thighs and calves. Additionally, Tai Chi and yoga can enhance balance and coordination while gently facilitating strength restoration. Your physician may also suggest evaluating your vitamin D levels and providing supplementation if necessary, in addition to reviewing any medications that may contribute to muscle weakness. If a neurological condition is suspected, early intervention can substantially impact the progression and maintenance of independence. Tom took the information earnestly. He enrolled in a senior fitness program, collaborated with a physical therapist, and initiated a home regimen concentrated on lower body strength. Gradually, he restored confidence in his movements. Crucially, he now understands that difficulty in rising from a chair is not merely a minor inconvenience. It is a signal that warrants attention, a subtle yet pressing communication from the body. As we have observed, all 4 leg-related warning signs, cramps, numbness, swelling, and weakness, serve as the body's means of conveying messages before conditions deteriorate. However, knowledge alone is insufficient. In our concluding section, we will consolidate all information and discuss actionable steps you can take immediately to safeguard your health, maintain mobility, and live with strength and dignity for years to come. If you are still viewing, it indicates a genuine concern for your health. Please leave a 6 in the comments to demonstrate your support. Additionally, subscribe and activate notifications to ensure you receive essential health tips. Let us pause to contemplate our discoveries. Your legs, frequently overlooked, serve as messengers conveying significant, occasionally painful signals that may indicate underlying issues within your body. We discussed 4 crucial signs, including sudden nighttime leg cramps. The sudden awakening sensation, the tingling or numbness in your feet indicating potential nerve issues, the swelling in your legs or ankles suggesting cardiac distress, and the increasing weakness that transforms standing from a chair into a laborious task. Each of these indicators may appear insignificant individually, yet collectively they convey a narrative. A narrative your body endeavors to communicate before conditions deteriorate. However, the reality is that none of this is predetermined. These are not merely symptoms of aging. They represent opportunities for proactive intervention.